Okay, so you're gearing up to become an LPN.
That's great.
And you're probably deep in the books right now.
Yeah.
And I bet you're hitting that nutrition chapter pretty hard.
Absolutely.
Because let's face it, good nutrition is like the cornerstone of good health.
It really is.
So we're going to do a deep dive today into this whole world of alterations in nutrition.
Sounds good.
And how it all ties into your role as the future LPN.
Right.
We're going to be using your textbook chapter as our main guide here.
Perfect.
Our mission is to help you ace that upcoming exam.
Of course.
And also to really grasp those practical skills you'll need out there in the field.
Yeah, I think that's really key.
You know, one of the things that really jumped out at me from the chapter was that statistic about malnutrition in acute care.
Oh, yeah.
They said somewhere between 30 and 50% of patients are either malnourished when they come in,
Right.
or they become malnourished during their stay.
It's a huge problem.
It's a big deal.
It is. And it's not always as straightforward as just telling people to eat better.
Right. You can't just hand them a pamphlet and call it a day.
Exactly.
There are often these underlying barriers that get in the way
Yeah, for sure.
of people getting the nutrition they need.
So many factors to consider.
And that's where you as an LPN come in.
Absolutely.
Your job is to be that detective to figure out what those roadblocks are.
Right.
And then come up with creative ways
Uh-huh.
to help your patients overcome them.
I like that detective analogy.
The chapter does a really good job of laying out some of the biggest barriers.
Mhm.
And one that we might not always think about right off the bat is poor dentition.
Interesting.
We tend to think of it as an older adult problem.
Yeah, dentures and stuff.
Right. But it can affect people of all ages.
Oh, that's true.
Think about little kids who haven't had good dental care.
Yeah.
Cavities can make chewing super painful.
Makes sense.
And for adults, you know, a bad toothache,
Mm-hmm.
ill-fitting dentures, things like that,
Right.
can make it really hard to eat properly.
Yeah, like imagine trying to build a house on a shaky foundation.
Exactly. It's all connected.
It is. And we have to remember that chewing is so crucial for digestion, too.
Right. It's not just about getting the food down.
It's about breaking it down properly so your body can absorb all those nutrients.
So as an LPN, you might be involved in school screenings for kids.
Mm-hmm.
You'll be doing basic dental screenings in different care settings.
Important part of the job.
And you'll be advocating for good dental hygiene.
Like brushing and flossing and fluoride treatments.
Exactly. And it's also about working closely with the dietitians.
Yeah, they're the experts.
They can come up with meal plans that are tailored to people who have trouble chewing.
Right. So softer foods, maybe smaller portions, things like that.
And they might recommend supplements to fill in any nutritional gaps.
That's really smart.
So yeah, when we think about nutrition, we've got to think about the whole picture.
From the teeth to the stomach and everything in between.
All right, let's move on to another major barrier. And this one's a biggie: low socioeconomic status and lack of access to nutritious food.
Yeah, that's a tough one.
The chapter really digs into the economics of food.
Mm-hmm.
It points out that fresh fruits and vegetables often cost more than processed foods.
That's the reality for a lot of people.
And it's not just the price. It's the nutritional trade-off.
Right. You get more calories for your buck with processed food.
But you're not getting the good stuff.
Not the vitamins and minerals your body really needs.
And you're getting a lot of added salt, unhealthy fats, and simple carbs.
Not a great combination.
Especially if you're trying to manage a condition like diabetes or high blood pressure.
It can make things so much harder.
So this whole idea of food insecurity, it's not just about not having enough food.
It's about not having access to healthy food.
And that can be due to a lot of factors.
Like what?
Well, cost is a big one, obviously.
Of course.
But it can also be about transportation.
Oh, yeah, if you can't get to a grocery store.
Right. The chapter talks about food deserts.
What are those?
So basically, it's when people live in areas where they're more than a mile from a supermarket, if it's an urban area.
Wow.
Or more than 10 miles from a supermarket, if it's a rural area.
That's a long way to go for groceries.
It's a huge barrier, and we have to remember
What?
that certain groups are disproportionately affected by food insecurity.
Yeah, who are we talking about?
The chapter lists low-income households, single-parent families,
Right.
many Black and Hispanic-headed households, and those in large metropolitan areas.
That makes sense.
So what can we do about this as future LPNs?
Good question.
Well, the chapter gives us some really good nursing interventions.
Let's hear them.
Connecting patients with dietitians is key. They can help people find nutritious options that fit their budget.
Yeah, like what?
Well, frozen fruits and vegetables are a good example.
They're usually cheaper than fresh.
And they're just as nutritious.
That's good to know.
Teaching patients how to read food labels is another big one.
Oh, yeah. Those can be confusing.
They really can.
Yeah.
But if you can break it down for them,
Yeah.
it can empower them to make healthier choices.
Right.
And then, of course, we can't forget about social services.
Connecting people with resources.
Exactly. There are food assistance programs, SNFP benefits, food banks, things like that.
That can be a lifeline for people.
They really can. And there might be community nutrition initiatives, too.
Like cooking classes or nutrition counseling.
Exactly.
Yeah.
So it's about knowing your community.
And knowing how to connect people with the help they need.
The case study in the chapter really illustrates this point.
Oh, yeah. Tell me about it.
It was about a client with hypertension
Okay.
who lost their job and couldn't afford their medication and healthy food.
That's a tough situation.
It is, and they ended up relying on cheap canned goods.
Not the best for managing hypertension.
Right, and the nurse in the case study
Yeah.
realized that there were these underlying social determinants of health at play.
That's a good term to remember for the exam.
It is.
Social determinants of health.
It means the non-medical factors that can affect a person's health.
Like poverty and lack of access to healthy food.
Exactly, and once the nurse recognized those factors,
Yeah.
they were able to provide much more effective care.
That's what it's all about.
Okay, so we've talked about dental problems and socioeconomic barriers.
Mm-hmm.
Now let's switch gears and talk about cognitive disorders.
Like dementia and Alzheimer's.
Exactly. These conditions can create real challenges when it comes to nutrition.
How so?
Well, they can affect memory and judgment,
Right.
which can make it hard for people to do things like grocery shop
Yeah.
or choose healthy foods or even prepare meals.
So it's not just about physical limitations.
It's about cognitive limitations, too.
And it can get even more complicated as these diseases progress.
What do you mean?
Well, people might forget that they've eaten.
Oh,
Or they might refuse to eat altogether.
that's so sad.
It is. Or they might fixate on just a few foods.
And not necessarily nutritious ones.
Right, which can lead to deficiencies.
So as an LPN caring for these patients, you'll need to be extra patient and understanding.
Definitely.
The chapter recommends encouraging assisted shopping,
That's a good idea.
maybe having a detailed shopping list.
Yeah, to help them stay on track.
And for those who are in care facilities, routine is super important.
Why is that?
Well, it can help to reduce confusion and anxiety.
That makes sense.
So having meals at the same time every day in a familiar and calm environment
Right.
and minimizing distractions during mealtime.
Oh, good strategies.
And then there's some more hands-on things you can do.
You what?
Offering snacks between meals,
To boost calorie intake,
cutting food into smaller pieces,
so it's easier to manage.
providing gentle reminders to chew and swallow,
Yeah, that's important.
and using techniques like the chin tuck to help prevent aspiration.
These are all great things to keep in mind for the exam.
Absolutely. They really highlight the practical side of LPN care.
It's about creating a supportive and structured environment.
Exactly.
Okay, so we've covered cognitive issues. What's next?
Let's talk about altered sensory perception.
Oh, that's interesting.
This one can be a bit sneaky
How so?
because changes in vision, smell, or taste
Yeah.
can really affect someone's relationship with food.
And ultimately, their nutritional intake.
Exactly. For example, if someone has decreased vision,
Mm-hmm.
it can make it hard for them to navigate a grocery store
That's true.
or even just to prepare a meal safely.
Yeah, they might accidentally cut themselves or burn themselves.
Exactly. And in a care setting,
Yeah.
something as simple as setting up their meal tray
Mm-hmm.
can make a world of difference.
It's all about making things easier for them.
Now, the chapter also talks about the connection between smell and taste.
Oh, yeah, they're closely linked.
So if someone loses their sense of smell,
Mm-hmm.
their sense of taste can also diminish.
Which can make food seem bland and unappealing.
And there are lots of things that can cause a diminished sense of smell.
Like what?
Well, smoking is a common culprit,
Oh, that makes sense.
and certain medical treatments can also affect taste.
Give me some examples.
Chemotherapy can sometimes leave a metallic taste in the mouth,
Yeah.
and radiation therapy to the head and neck can sometimes lead to a loss of taste,
Wow.
either temporarily or permanently.
That's a big deal.
It is. It's sometimes called mouth blindness.
I've never heard that term before.
Yeah, it's pretty descriptive, though.
It is.
So as an LPN, you'll need to be aware of these potential sensory changes.
And adapt your care accordingly.
Exactly. So for someone with vision impairment,
Mm-hmm.
you might encourage them to have someone help them with shopping,
That's a good idea.
or maybe look into grocery delivery services.
Yeah, those are becoming more and more popular.
If they're experiencing nausea or food aversions, you
Yeah.
might recommend cooler foods
Those tend to be more tolerable.
And for someone with a diminished sense of taste, you might suggest foods with stronger flavors.
To help stimulate their taste buds.
Exactly, like spicy foods or tangy foods.
That makes sense.
Hard candies, mints, or chewing gum can sometimes help to mask unusual tastes.
Well, that's a good tip.
And the chapter emphasizes that it's important to discourage people from filling up on empty calories.
Right.
So if their food intake is down,
Yeah.
you might recommend nutritious supplements.
And I make sure they're getting what they need.
It's all about adapting to the individual's needs.
I like that.
All right, moving on to another important topic.
Okay.
Impairment in swallowing.
That's a serious one.
It really is, and it's something that LPNs need to be very knowledgeable about.
Absolutely.
So let's start with mechanical fixation of the jaw.
Okay.
This often happens after facial trauma,
Right.
and it means that the jaw is wired shut.
So they can't open their mouth.
Exactly. So in these cases, a liquid diet is necessary.
Makes sense.
And your role as an LPN would be to encourage adequate fluid intake.
That's crucial.
And to work with the dietitians to come up with a liquid meal plan that provides all the necessary nutrients.
Yeah. You wouldn't want them to miss out on anything.
Exactly.
Yeah.
And you might even need to show them how to use a straw effectively.
Okay. Right.
Now, there's also dysphagia.
Which is difficulty swallowing.
Right. And this can be caused by a variety of things.
Like what?
Neurological disorders like Parkinson's disease, cerebral palsy or stroke, or surgical procedures involving the mouth, throat, or larynx.
So it can be a temporary or a permanent problem?
And with dysphagia, there's always a risk of aspiration.
Which is when food or liquid goes into the lungs.
It can be very dangerous.
It can lead to pneumonia and other complications.
The chapter also mentions how oral cancer surgery can affect the mechanics of chewing and forming a food bolus.
That's interesting.
And there's a difference in aspiration risk.
Tell me more.
Between a partial laryngectomy and a total laryngectomy.
I see.
So the nursing care for patients with dysphagia is absolutely crucial.
No doubt.
You have to be constantly monitoring for any signs of aspiration.
What are some of the signs?
Coughing, choking a wet-sounding voice, and having suction equipment readily available.
In case they start choking.
Exactly. You would be working closely with the dietitians.
To figure out the best diet plan.
Right. They'll recommend the appropriate level of the National Dysphagia Diet.
Oh, tell me about that.
So it has different levels.
Okay.
Pureed, mechanically altered and advanced.
Interesting.
And the idea is to make sure that the food is a texture that the patient can safely swallow.
That makes a lot of sense.
You might also need to thicken thin liquids.
To make them easier to swallow.
Exactly. And other important nursing interventions include allowing ample time for meals.
So they don't feel rushed.
Making sure the patient is well rested beforehand.
Because eating can be tiring.
And teaching techniques like the chin tuck maneuver and tongue arching.
Yeah, those can really help.
These are all life-saving skills.
Literally.
Okay, so let's move on to another barrier
Right.
that might seem a bit more basic, but it's actually very common.
What's that?
Lack of knowledge and misinformation about nutrition.
Oh, yeah. There's so much confusing information out there.
It's overwhelming.
With all the fad diets and the conflicting advice.
Right. It's hard to know what to believe.
It is, and people might not have even learned the basics of nutrition.
You know, like the food pyramid or My Plate.
Or how to read a nutrition label.
Exactly. So as an LPN, you'll play a big role in patient education.
Absolutely.
You'll be guiding people towards reliable sources of information.
Like government websites or reputable organizations.
Like the American Heart Association.
Yeah, they have great resources.
You might help them find community nutrition education programs.
Like cooking classes or grocery store tours.
Right, and you'll be teaching them how to decipher those nutrition labels.
It's like a secret code sometimes.
It is, but once you know how to read them, it can really make a difference in your food choices.
I bet.
Keeping a food journal can also be helpful.
How so?
Well, it can increase awareness of what you're actually eating.
That's true.
And it can help you identify patterns in your diet.
That's smart.
And, of course, you'll be providing information about healthy foods and portion sizes.
And warning people about those too good to be true weight loss claims.
Exactly. The chapter has this act of learning scenario where an older adult admits that they've never really paid attention to the nutritional value of food.
Wow.
It just goes to show that even seemingly simple concepts might not be common knowledge.
It's a good reminder for us as future nurses.
To never assume anything.
Right.
All right, we're almost through the barriers.
Okay.
The last one the chapter discusses is medical conditions.
Makes sense.
Because certain conditions can really increase the risk of malnutrition.
Give me some examples.
Well, cancer is a big one.
Okay.
Also, COPD, buzz trauma, HIV/AIDS.
Wow, that's a lot.
It is. And there are lots of reasons why these conditions can lead to malnutrition.
Like what?
Well, some people experience loss of appetite,
Yeah.
or nausea, or mouth sores.
Those would make it hard to eat.
Exactly. And some conditions increase the body's energy needs.
Do they need more calories?
Right. And sometimes people just physically can't eat a normal diet.
Due to surgery or other medical procedures?
And even something as routine as being NPO,
Nothing by mouth.
right, for diagnostic tests,
Yeah.
or the use of multiple medications,
Polypharmacy?
can create nutritional risks.
So what should we be doing as nurses?
Well, monitoring diet prescriptions and lab results is key.
Especially for people who are NPO or on restricted diets.
Exactly. And referring to dietitians for a full nutritional assessment
They're the expert.
and being aware of potential drug-nutrient interactions,
Yeah, some medications can interfere with the absorption of certain nutrients.
and vice versa.
Right, so it's a two-way street.
And sometimes you might need to consult with a pharmacist.
They get their expertise.
And then there's some simple interventions,
What?
offering small, frequent meals,
That can be easier to tolerate.
ensuring good oral hygiene,
Important for preventing infections.
and avoiding alcohol-based mouthwash,
Oh, yeah. That can sting if someone has mouth sores.
and providing liquid nutritional supplements between meals.
To boost calorie and nutrient intake?
The chapter talks about a client with hypertension
Okay.
who wasn't adhering to their dietary recommendations.
Well, that's common.
It is, and it highlights the importance of patient education,
And understanding the patient's perspective.
because there might be cultural factors or personal preferences.
Right. That we need to take into account.
So as you're studying for your LPN exam
Mm-hmm.
and preparing for your future career,
Yeah.
keep in mind that this whole topic of alterations in nutrition,
It's not just about memorizing facts.
it's about understanding the real-world challenges that your patients might face.
And knowing how to help them.
You'll be observing them during meals.
Looking for any signs of trouble.
You'll be educating them about healthy choices.
And advocating for their nutritional needs.
And you'll be working as part of a team.
With dietitians, social workers, doctors, and other healthcare professionals.
To ensure that your patients are getting the best possible care.
I like that teamwork approach.
Okay, so a quick recap for the exam.
Get me with it.
We covered physical barriers like dental problems and swallowing difficulties,
Mm-hmm.
economic barriers like poverty and lack of access,
Right.
cognitive and sensory impairments,
Okay.
knowledge deficits,
Got it.
and the nutritional impact of medical conditions.
So many things to consider.
Your job as an LPN
Yeah.
is to be that observant and compassionate caregiver.
Always looking out for the patient's best interests.
Exactly. So here's a final thought for you to ponder.
I'm listening.
As a future LPN, how will you approach those nutritional challenges
Yeah.
with creativity and empathy?
That's key.
Remembering that food is more than just fuel.
It's connected to people's lives and their textures.
It's part of who they are.
Absolutely.
So good luck with your exam and with your future career.
Thanks. I'm feeling more prepared already.
Awesome.
I appreciate the deep dive.
Anytime.
It was really helpful.
Glad to hear it.
I feel like I have a much better grasp on the material now.
That's what we aim for.
And I'm excited to put this knowledge into practice.
That's the spirit.
Thanks again.
You're welcome.
I'll catch you on the next deep dive.
Sounds good.